Hi, I'm Dr. Simranjeet Singh, consultant neurosurgeon, ARHI Hospital, 11th mile, Jorabat. Today, I would like to talk about back pain, specifically low back pain, chronic low back pain. Now, back pain is something which affects almost every one of us at some point of time or the other. Most of the times, the back pain might be low-grade back pain with non-specific chronic aching type of pain, and it's usually self-limiting. The patient usually gets better in a few days. But sometimes the back pain might be more severe, more chronic, or maybe recurring, relapsing, goes away for a few days, comes back, or it's so severe, so debilitating that it's significantly affecting the quality of life. Then sometimes it might be associated with more dangerous symptoms like pain which is radiating down the lower limb. The patient has low back pain with pain which is shooting down the leg. So it's just simply getting up from the bed, sitting, or standing for more than a few minutes might be difficult because there is severe pain shooting down the leg. Now, normally we, as I said, almost every one of us has low back pain at some point of the time or the other. Now, as long as the back pain is not associated with any serious symptom, is self-limiting, a patient is improving, does not affecting the quality of life, definitely we can try simple home remedies, over-the-counter medications, changing posture. So simple things might help it. But when the pain is not improving, say beyond 72 hours, or is associated with any of the danger signs, then definitely some intervention is needed. More workup is needed. Definitely you have to seek medical attention. Now, if I talk about the human spine, now the human spine is a beautiful piece of engineering. So there are multiple vertebrae or blocks of bones which are actually put on one top of the other with these cartilaginous discs between them. Now these cartilaginous discs are soft cushion-like structures which act like shock absorbers between these vertebrae. So when we are standing, sitting, jumping, so it provides for motion. So that gives us the ability to move, to bend. We can move our neck, we can move our back. So that is because of the presence of this cartilaginous disc between these vertebrae. But as we get older, these discs they start to lose their elasticity, become less and less elastic, more prone to injury, especially with weak muscles. So if the muscles are weak, bones are degenerating, these joints are not locking then the discs are exposed to more significant trauma, can easily rupture, and this ruptured disc can impinge these nerves, then causing those symptoms of severe pain in the leg. And behind this vertebral body, there's a small canal through which this main spinal cord is passing, which connects our brain to the limbs, to the gut, to the lower limbs. And if the disc is compressing this nerve, or sometimes rarely there might be something like a tumor or some malignancy, some space occupying lesion which is compressing this nerve. Then there might be weakness in the limbs, weakness in the hand, we are talking about low backache. So there will be weakness in the lower limbs, or maybe loss of bladder bowel habit, that can occur because of this. Now, as I said, so for simple chronic back pain which is self-limiting, not lasting more than 72 hours, yes, definitely we can try simple home remedies, hot fermentation, rest, over-the-counter medication. But then pain which is not improving, not letting you come out of the bed, recurring, relapsing, or associated with any of the danger signs, as I said, like pain which is shooting down the leg, there's loss of power, loss of strength in the leg, or loss of sensation in the foot, or even more dangerous, say loss of control of bladder, bowel, you are unable to hold your urine, or having difficulty passing urine because of the pain. Definitely there might be some serious pathology associated with that back pain. So definitely needs more evaluation, needs medical attention. Now, usual culprits. If I talk about the usual culprits which are causing chronic, relapsing, recurrent low back pain, number one would be the posture. Say jobs which make you sit too long at the desk, especially if you're not sitting correctly, if you're like bending forward, your back is not well supported by a chair, and the table itself is of the incorrect type, where there's insufficient space for your legs to go in, your hands are not properly supported by the table, so that whole posture posture while sitting, posture while working, walking, है ना? So definitely that will be a cause of your chronic recurring low back pain, है ना? Then the physical health, है ना? If the muscles, if the core is weak, है ना? The muscles are weak, there's too much of fat, है ना? In the abdominal region, है ना? And the muscles are not holding the spine as well as it should. Definitely it will lead to more injury of the say these joints, this disc, है ना? This whole structure, so it will lead to chronic, relapsing, recurring low back pain. Then even say, as I said, prolonged sitting, prolonged standing can be a cause of low back pain. Too much of exercise, lack of exercise is the cause of low back pain, but too much of exercise which is say not done in the correct way, where the warm up is not proper, or the lifting technique is incorrect, or after a prolonged period of say rest, suddenly you picked up exercise and the exercise is not escalated in the correct way as it should have been. Definitely that itself can be a cause of low back pain, injury to the back, and then sometimes there might be an underlying pathology, as I said. So there might be a injured disc, a ruptured disc, which is impinging the nerve. There might be say growth of osteophytes from the bone, which is impinging the nerve, or maybe reducing the canal diameter. Rarely there might be a tumor within the spinal cord, which is a tumor which is compressing this cord, causing say loss of bladder, bowel sensation, severe pain in the legs. So now if I talk about who's at risk of back pain, mostly what we see is it's people in their late 30s, 40s. So they are the ones who present with say early degenerative disc disease, ruptured disc, rarely with tumors. As people, the patient population gets older, mostly it's related to osteophyte growth, osteoporotic spine. There might be trauma. Say there might be a trauma in the past, which could have left some residual damage, because of which the person has having chronic recurrent back pain. Now, if I talk about what would be the usual diagnostic algorithm for a person who presents with back pain, so initially definitely we'll start with the history, how the pain started, what kind of activity he is doing, is it a sitting job, desk job, or is he say maybe using too much of a two-wheeler and using bad roads, that might be a cause. So we try to look for the causative agent, what is causing that chronic, recurring, relapsing back pain. Then the symptoms, of course, what kind of symptoms he has. So X-rays, yes, definitely, like especially standing X-rays. Standing X-rays with flexion, extension, they provide a very good dynamic view of the spine, about the intervertebral distances, from where we can get a good idea about presence or absence of any dynamic instability in the spine. Then the MRI is the best investigation when we want to look for the actual disc, the actual nerve, the foramens, the space for the spinal cord, when we are actually doubting some tumor, some say herniated disc, some injury. So CT again gives a very good information about the bony structure, but the disc and the nerve, they are the best seen in the MRI. Then there's a lot of doubt about bed rest. So how long should a patient be put on bed rest with back pain? So normally we'll say not more than 2-3 days. If the pain is not improving up to 2-3 days, definitely needs some treatment, some evaluation, some medication, some intervention. Then a lot of people ask about say yoga, about alternative therapy. Yes, definitely it can be tried. But if any danger symptom is there, pain is aggravating, not improving, and then definitely he needs further evaluation, further intervention. Then again, say when we talk about physical therapy or physiotherapy, it has a definitive role, yes, for helping you exercise the back muscles, for increasing the strength of the core, because these are the muscles which are holding the spine. But then again, if it's causing an aggravation of the symptoms, pain is not improving, severely affecting quality of life, definitely you need further evaluation, treatment for that. And then surgery. No, definitely every patient with backache does not need surgery. But as I said, if there is a significant underlying pathology, significant nerve impingement, the patient is on bed for a long time, or severely restricted mobility, or say if there's, as I said, a spinal tumor, some significant pathology, a herniated disc which is significantly compressing the nerves, definitely some surgical intervention would be needed. And then for preventing back pain, I would say number one thing would be to have maintain a healthy diet, a healthy weight, a regular exercise routine. So simple exercises like cycling, non-impact exercises where there's significant impact like jumping, running. So those would put more strain on the back. But exercises like say swimming, cycling, these usually do not put more strain on the back, and they would be recommended. Plus exercises for strengthening the core, for making the core muscle stronger. So those exercises are definitely recommended. And then lifting techniques. We would always say do not lift with your legs, do not lift with your back, do not crouch, do not bend. You use your legs for lifting. So you squat and then lift. So that lifting technique has to be correct. So even those who are using a two-wheeler, definitely do not have a weight on your back. Avoid any weight on the back, avoid bad rolls. And then smoking. Smoking again is related to increased chance of chronic back pain, loss of bone density, osteoporosis, again a cause of chronic low back pain. So in the end, I would like to say yes, staying healthy, staying fit, having a good diet, regular exercise program definitely can prevent a lot of chronic back pain. And then if it's not improving, definitely you should seek expert medical opinion, because you do not have to live with the pain, as it can be easily cured, easily treated, easily avoided. Thank you so much.